All right. We're going to get started now. I hope everyone's full and happy from lunch. And so speaking now, we have Dr. Jeffrey Kamlet. And so, he's done over 1,800 Ibogaine sessions. You stopped counting, though, eventually. And all around the world, traveling and giving folks Ibogaine. He's also the Gita's chief medical advisor, among many other various qualifications. And so without further ado, I'll leave it to you. Here you go.
Hi, everybody. Can I change seats with you? So I'm afraid if I move this, we'll lose the PowerPoint. Hope you don't mind if I sit. And thank you all for coming to this conference. Just take a second and some of you I know and some of you are new friends. So I'm a physician. I initially trained in internal medicine and neurology. I moved to Miami to do a cardiology fellowship. Somewhere, years previous to that, due to my experience with entheogenic plants, I had some ethical problems with medicine. I said, I can't practice cardiology. This is all wrong. So for the next 12 years, I worked in emergency medicine. There were less ethical questions. You know, somebody has a broken leg or has a gunshot wound. There's very little questions as to what needs to be done, as opposed to giving chemotherapy to somebody with pancreatic cancer where there's no proof that that does any help, ever helped anybody. So here I had this decade of emergency room experience and cardiology experience, and I had been board certified in addiction medicine somewhere in the early 90s. Being a person in recovery myself for years, I'm a fellow of the American Society of Addiction Medicine for over 25 years and been boarded for over 25 years in addiction medicine. I've held various positions as president and things like that in the organization. I've also recently been somewhat critical in getting cannabis approved in the state of Florida. It just got legalized as medicine, and I'm on a new initiative. They may have a list of diseases that cannabis can be used for, and I'm trying to get added to that list, opiate withdrawal. Cannabis to assist for opiate withdrawal, because now they're saying, insurance companies are saying, oh, patients on Suboxone and they're using cannabis, even if they have medical cannabis, we're going to deny paying for their Suboxone because we consider that to be an illicit substance. So this lecture is a little bit of different than the typical lectures I usually give, where everybody in the audience is a physician, scientist, or PhD, or something of that nature. So I wanted to talk a little bit about entheogenic drugs and then what's so special about Ibogaine. It was approximately 1996 when Dr. Mash had done a few patients in Panama. Patrick Krupa spoke a little bit about that. And through some very strange story, some woman healer said she went to sleep, had a dream, and went to go somewhere. She met Dr. Mash, she knew me, introduced us, and Deborah needed a physician to do these treatments in St. Kitts, and we started the St. Kitts project, doing approximately 380 patients over 7 years. Unfortunately, for various reasons, that data, that 7-year collection of data on those 380, which were supposed to be given away to the FDA, was never released, and I'll leave the reasons why for another day. But I was present for every single one of those treatments, and most of the medical things we found out about Ibogaine and dosing and safety, like QT prolongation and other things we'll talk about, came from my observations. Even we spoke about the first night here, Ibogaine's antiviral properties were something that was just anecdotally found out, that HIV patients and hepatitis C patients had lower viral load levels after Ibogaine, where after standard US treatment, they had greatly increased levels. And I thought it was just due to the stress of pharmaceutically assisted detox versus the ease of Ibogaine, not realizing that Ibogaine itself may have some antiviral properties. So, sacred plant medicines, entheogens versus Ibogaine, and what's so special about Ibogaine. Our lives are not our own. From womb to tomb, we're bound to each other, past and present, and by each crime and every kindness, we rebirth our futures. I don't know if anybody's ever seen the movie Cloud Atlas. If you haven't, it's a wonderful movie. But these are lessons that I think are taught to people by plant teachers. All of us being here in this paradigm that we call life, womb to tomb, are bound in a self-centered model where we consider ourselves to be the master beings of this planet. And from a very early age, before I ever took my first entheogenic plant, I pondered, what am I doing here? What is this? Where did I come from and where do I go after I die? So I asked myself, why do we act the way we do? What's the purpose of hormones that create sexual drive? What's the purpose of fashion? Why do alphas seek to hook up with alphas? Why do we act the way we do? We consider ourselves to be the master creatures on this planet, and I don't really think we are. DNA is the master. Everything we do, this paradigm is that DNA reproduces itself. The whole idea behind sexual drive and everything else, okay? And it's the same master DNA that's been present since man has been put on this planet. And I think you can get an insight into tapping into genetic memory through this DNA. So before I ever went to medical school, I was sitting in a bed in a dorm in University of San Diego, listening to some music. And a friend of mine, may he rest in peace, he died with a needle in his arm, but he was my best friend, had put a couple of drops of, and I don't know how many, but a few thousand micrograms of LSD on the top of my head, liquid LSD, and I sat in that bed for 8 hours. And I didn't realize 8 hours had gone by, but I saw things. I saw amazing things. And I remembered those things I saw. Approximately a month later, I was back in New York City, and I went to a place in Staten Island called the Jacques Marseille Museum of Tibetan Art. I'm looking at a wall at a Tanka painting, which was painted over 200 years ago, sacred Tanka painting. I'm saying, holy shit, that's what I saw. How could somebody have painted something 200 years ago that I just saw in my mind's eye under the effect of this drug? And I started to thinking that this consciousness, this universal consciousness, the concept of genetic memory that is accessible to us, and why am I limited? Why can't I see that in this paradigm? And it's an interesting, you look at this slide, just talks about stages of evolution. We must be doing something right because we're the only species that actually records our history, whether they're the smartest species on the planet or not, I don't know. But we have artificial intelligence, and we're talking about the age of spiritual machines, and are the machines going to become smarter than us? And if you follow some of the work of Ray Kurzweil, there's been a massive explosion of the use of entheogenic drugs. Ayahuasca sessions are being done all over the world. I remember in the early 1980s reading a book called The Wizard of the Upper Amazon. Nobody ever heard of ayahuasca, and they were calling, in this book, they called it yage, and I went and sought out to find this drug. I went to live in Mexico with the Huichol Indians, and it took me about 4 years of traveling up into the Sierra Madres, and eventually went on what they call something called Wirikuta, which is a travel to take peyote, and was made, quote unquote, a shaman in the Huichol culture. And back then we used to say real shamans don't advertise or go around and call themselves shaman. And the interesting part was that the word shaman had that word shame in it, That it was interesting that many of the Huichol shamans would become alcoholic and then again take another wirikuta and regain their sobriety. So I had my first experience when using entheogenic plants for substance abuse problems. So now we're approaching, there's a lot of talk about the age of spiritual machines. And Ray Kurzweil has written a book, interesting book, and he calls it The Singularity. And he says by 2040, the combined intelligence of one computer will outthink the combined intelligence of all man together. That there will be these robots. And what happens? So if you read Asimov's Rules of Robotics, what do we program these robots to do so they really work to serve us? And it occurred to me, what makes us think we're not actually spiritual machines already? I'm a consciousness in a body. And though it's not metal, I require fuel. Okay, I do make That fuel comes out as combusted as waste products. I require nutrients. It ages. It wears out. And because it's made of flesh and other stuff, it really is not anymore in the term of how do we know we're not a brain in a vat running some computer program somewhere looking at this. And it's interesting because soon we're going to have metal machines, and I'm not so sure that we're not already that. The problem is, in modern age, is man's conflict against self. This internal struggle. This is a conflict that usually associated with an external conflict. A character must overcome his own nature to make a choice between two or more paths, good or evil, logic or emotion. Now, after having that liquid LSD experience that I told you about, like many of us who do Ibogaine for the first time, I was naive to think, oh my God, wow, if everybody on the planet took this, it would be the cure for world peace. Okay, well, it's 40 years later, and I found out when I give these drugs to sociopaths, now all they do is open up a clinic. You know, all right? You know, I see people who take ayahuasca, and then the next thing, I've got to give it to every single person I know and take it every single day, you know? And I try to tell my patients, it's not your job to, you know, take this information and bring it back and incorporate it into your own life, you know? If you have the desire, you want to go to Gabon and become a Bwiti, be my guest, but I'm not so sure all of that is necessary, okay? Take the information, incorporate it in what you do, and make your decisions accordingly. You know, so everybody's looking out at universes and universes and universes, and if we think we're going to get anywhere in a tin can, you know, the closest star to Earth is Alpha Centauri. It takes, I think, 160,000 light years to get there. So if I was traveling at the speed of light,
but 4 is a long way.
Yeah, you know, I wouldn't age, and it would take me 60,000 years to get there. So this idea that we're going to get anywhere in the common mode of thinking of, you know, space technology today, you know, I think the way we're going to do interstellar travel is through the use of entheogenic plants. And the same force that powers lightning powers the same synapses in our brain. So whether I'm looking at the cosmos or I'm looking at this table and saying this is 90% air and there's universes and universes, you know, and quarks and electrons and small particles, it gets really, really small and it gets really, really large. So there are a lot of similarities and a lot of differences between entheogenics and Ibogaine. And I'm using this word entheogenics. I hate the word hallucinations. We're going to get into that in a minute. So how do entheogenic plant-based drugs work and why? So number one, a new thing is happening. There was a day when all these drugs were natural. And now we're coming up with synthetic spiritual drugs. And the question is, are these drugs really sacraments? I believe Ibogaine, this is something I can't say at a regular scientific conference, but, you know, I'm a scientist. I do clinical trials. Science is reproducible and predictable every time, and it must meet scientific theory to be okay. In my book, my whole modus operandi is against junk science. Yet I do believe Ibogaine is a sacrament, as many of these plants are. And now it's an interesting thing. We have natural versus synthetic drugs that are doing this. And is there a difference? So looking at the natural drugs, we've got peyote and mushrooms and iboga and the DMT analogs like ayahuasca, morning glory seeds. Even LSD is derived from ergo fungus. So can we tap into universal consciousness and genetic memory through the proper use of plant-based chemicals? And if that experience is healing, thus is it entitled to be called a medicine in the modern term of what we consider medicines? Can the same be said of the synthetics? Now, I show this picture here because this is LSD that's being sold in the United States now, which is not LSD. It's something called N-bomb, and people are dying from this drug. Now, why would somebody be so evil to, like, make fake blotter acid? Okay, because I can buy a kilo of this stuff on the black web for like $20 and make thousands of hits. And I'm testifying in a case now. I was asked to testify in a case where some young gentleman took this thinking it was acid, had a seizure, and died. Because N-bomb has a lot of bad side effects to it, but it gives you an LSD-like experience, but it's purely not a chemical that exists in nature. It's purely a synthetic chemical. So we're all connected to nature, but limited by our five senses as to what our paradigm is. We have five senses that allow us to interpret this world as we are. And we feel separated from nature. And it's interesting, the Bwiti call the Ibogaine the forest plant. They say it allows them to learn how to speak to the forest. They speak to they understand the trees, and the trees speak back to them. Plant communication with each other. If those of you who were at the Positlan heard Dr. Alper give a very brilliant lecture about how trees talk to each other and what is the mechanism, how do they talk, what's their telephone line, communicating through mycelium. So two trees are put in a vacuum and one is deficient of carbon dioxide. The other tree gets a signal and sends that other tree carbon dioxide in some sort of helping fashion. So the plants are communicating to each other, and we don't consider them to really be alive as we are, but I think they really are just as alive as we are. So the question is, can we communicate with the plants, as the Bwiti clearly think they do? Can we tap into genetic memory, and can we learn proper behavior and get closure to previous traumas through medically assisted entheogenic treatments? I think most people sitting here in this audience obviously know the answer to this. So this is where I have a problem with this word, hallucinogenic drug. This is the definition of hallucinogen when I looked it up in a medical textbook. A drug that causes hallucinations, profound distortions in a person's perceptions of reality. Under the influence of a hallucinogen, people see images, hear sounds, and feel sensations that seem real but are not real. So schizophrenia versus the spiritual experience. So hallucination is when Son of Sam is telling me the dog is telling me to kill people. That's a hallucination. It's not real. It's a wrong association. It's a disconnection. What's happening under these entheogenic plants is as real can get. You ever go to sleep and have a dream and wake up and say, which is the dream seem more real than waking up? In the Tao Te Ching, Lao Tzu wrote, am I a butterfly dreaming I'm a man? Am I a man dreaming I'm a butterfly? So modern medicine has a lot to learn. During the proper use of plant teacher medicines like Ibogaine, no wrong associations are being made unless there is schizotypal tendencies in the consumer prior to treatment. Really bad idea if you are schizophrenic to do hallucinogenic drug. And some patients, I've seen this, when all you're doing is talking to someone on the telephone, they can seem very, very normal. And noticing that every once in a while they have mild schizotypal tendencies. And I've seen this happen, that after they get through their entheogenic experience, now the schizophrenic tendencies are more profound. There's paranoia, they think they're being followed, and that could persist for as long as 6-8 months, and then they seem to go back to baseline. So it's really important, I think, that you meet your clients beforehand and you talk to them. And, I don't treat anybody unless they're sitting across my desk eyeball to eyeball. A phone interview is not enough. Get on a plane and come down to my clinic and they're going to dose you the next day. You want to do that? That's fine. But you better know how to shut this experience off. And there is a way of shutting it off. And when we get into safety, typically, when somebody goes to an ER and is having a bad experience on LSD, they're giving drugs like Thorazine and Haldol, antipsychotics. Never give antipsychotics to anybody taking Ibogaine. You will throw them into hell, and they'll stay there for days. The way to shut down a bad experience on Ibogaine is by using benzodiazepines, okay? Small dosages. If you don't have IV access, then give small dosages of oral, but it will take the freak out of the experience. And Ibogaine is very gentle on the ego when compared to other entheogenic drugs. I remember when Yage, first time doing ayahuasca, and it was called Yage, the French name for it was called the Little Death. And there was a point on that drug where I thought, holy cow, I am so far out here that if I go any further, there's no way I'm ever going to come back to my body and I'm going to die. And I remember that I read somewhere Geronimo said, there's a picture of Geronimo, said, it's a good day to die. And I said to myself, okay, then I'll die, hopefully, and I'll be that brave enough. And when I was able to get comfortable with that experience exploded like a nuclear bomb going off exponentially, 1,000 times faster. with thousands of images a second and colors that don't exist, and a very interesting experience and very different than, very Vedic, very unlike the experience on Ibogaine. So if the visions, so when I give this lecture to scientists in the room, I get a lot of feedback. Oh, it's all in your mind. It's not real. It's the context of whatever's already been in your mind. It's how you're interpreting things. So if I agree with them, which I don't, and the visions are random and they don't exist and they are unreal, and I think they are as real as life itself, but not always accessible to our consciousness, because in this paradigm we're limited by our five senses. So the brain's ego protective mechanisms allow us to deal with each disconnection, insult, lie, and our egos that we need to survive in this hallucination called life, womb to tomb. And we all do this, okay? I was reading an article that the average honest person probably lies 15 times a day, and even the Pope and the Dalai Lama probably exaggerate things at certain times in their lives. It's the nature of our lives. So what is the hallucination of womb to tomb? Because I'm getting a lot of feedback from these scientists telling me that what you're seeing, this isn't real. It's random. Well, if it's random, why is everybody seeing the same thing? And it's very specific. The people know, this was studied in UCLA in the 70s. People on LSD had commonality of vision. People on Ibogaine have commonality on vision. People on peyote have commonality of vision. These drugs all have their own plant animes, their own color spectrums, their wavelengths. And where the plant grows, it affects what you see, like Ibogaine being a very African experience. So if we're going to say these experiences are random and they're not real, then I ask the audience, when I'm speaking to these PhD types, then tell me, what's the most potent hallucinogenic substance on the planet? And they all start raising their hands. It's 3CB, and it's harmaline, and it's this, that, and the other thing. And I wait till they're all done, and I tell them, no, it's oxygen. Because if I take away your oxygen, this hallucination is going to disappear. Okay? And I'm telling them what's happening under Ibogaine is as real as this, okay? We just can't tap into it. It's right there. These entities, these higher entities, are right here. We just can't see them, okay? And Carl Jung said, coincidence is God remaining anonymous. God can't come down and kind of like slap you in the face and say, hey, I'm a holy being and you need to act in proper behavior, It just wouldn't work. But when something happens to you and it's 1,000,000,001 chance that happened, you need to look at that and say, like, what's going on here? Because there are signs being given to us every single day telling us, get on the right path and do things, in a certain way. So these are the list of what standard psychiatry calls ego protective mechanisms, and they go on to things like transformation and sublimation and countertransference. And basically, it's everything our frontal cortex does to let us deal with our bullshit, being dishonest, lying, and everything else. How do we live with ourselves and get away with this shit and not feel terrible about ourselves? And the better your ego defense mechanisms are, the better probably sociopath you are. We talk about addicts having low self-esteem. I think there's this concept of sociopathy, people who have what we call cluster 2 diagnoses of narcissism, borderline, sociopaths, as having negative self-esteem. Because when you have low self-esteem, you still feel bad when you steal somebody. But the guy who has negative self-esteem will steal your shit and then say, I'll help you look for it, and never feel any remorse about that at all. And you don't want to ever interact with that person. You cannot beat them, even if they might be the President of the United States. So what is there to learn from sacred plant teachers? These medicines have value in many fields of medicine and psychiatry. MDMA is being looked at MAPS now. I don't think MDMA is a true entheogenic drug. It's an empathogen. Okay, we're not really tapping into universal consciousness under ecstasy, but I am feeling empathy. But in some ways, you might feel love for the person you're taking the ecstasy with, and the next morning when the drug wears off, I don't really love that person, So I think it has value in psychotherapy, and hopefully soon it will be available. There are similarities among the experiences with different plant substances, and yet each is very unique. Despite the knowledge we gain from all these plant teachers, the answers of womb to tomb evade us. So if you have a lot of experience with various plant drugs, you get a lot of answers. You get proof that, guess what, there's really something out there. Okay? But I still don't get an answer as to where did I come from and where am I going? Then the question is, then what am I doing here? And I think we must all be doing something really right to be born in the most interesting, comfortable time in the history of written man. Think of really, there was an old saying, may you live in interesting times. Well, we certainly do live in the most interesting times and the most comfortable times. Get on an airplane and you're in Austria in 10 hours. So again, since I've been a young child, I've always had this idea of why am I here? Why do I exist? And I kind of warn people, don't get lost down the rabbit hole, because if you keep people chase for these answers, well, they're never accessible. No matter how much entheogens you take, you might get whatever you think your reason for being here is. And I've come up with my own theory of this. I call it the fallen angel theory, I've had people tell me that Ibogaine spirits have told them, I've had people who started taking Ibogaine for fun. I'm just going to keep doing it and because I want to be super Ibo man, Some people talk about how much milligrams they took like it's some badge of courage, and how ridiculous is that, The nature of everybody's experience is very different. And I've had lots of patients tell me that Mama Iboga came to them and said, do not come back here. If you ever need us, we will be there for you, but we're not here for your entertainment. So I said, it's kind of like if you're in a bar, if you're sober and some drunken guy comes up to you and he's talking and spitting and patting you on the back and you're like, get away from me, you annoy me, your anxiety. And I think we are born into this anxious place here, and I think our anxiety annoys them. But they're so benevolent, they really are. They exist at a higher level that they allow us a brief glimpse into their world that they might be of assistance to us. And maybe that's why we get sent back here, to get another chance at like getting this right and learning how to act in this paradigm. So what's it to learn from sacred plant teachers? So these medicines have value in many fields of medicine and psychiatry. There are some, okay. So I try to advise some of the patients, don't try and really, once you get this knowledge, you don't have to keep doing it and doing it and doing it and doing it, because eventually, it's really interesting. Has anybody had this experience where you've had a patient do Ibogaine maybe 6 times in 7 years, and 5 of those experiences were full-blown, like, holy cow, and the 6th time, the drug's in his system, the EKG changes occur, he's ataxic, and he tells you, I saw nothing. Nothing happened. And they feel like, I want my money back, wow, I got gypped, The plant gives you what you need, and maybe you didn't need to see anything, We're not here for your entertainment. So what is an exam or a practicum where the answers are not known but must be given? It's a test. Okay? I can't get the answers of womb to tomb. So it's a test. And I think that test is life itself. So we're spiritual machines which have the ability to make a choice. So can I learn proper behavior from ingesting sacred plants? I believe yes. Still, the answers will always elude you. So given this paradigm, what's so damn special about Ibogaine when many plants and perhaps synthetic variations can do this? Okay, a lot of people would say, is ayahuasca as good for alcohol as Ibogaine? And it's not. I've done this study with several patients. Is there something to be learned by taking LSD as opposed to Ibogaine? What's so really special about Ibogaine? Well, I'm a scientist. I treat diseases. I'm a physician. I treat the disease of addiction. The expanding mass of Ibogaine, it's been called this gross, what was the term they used? Unmonitored experiment in some of the scientific journals. Excuse me? Vast uncontrolled experiment, thank you. And that's basically what it is. I mean, the other night when I mentioned this really needs to be one day a medicine in the United States, and somebody said, well, if you can't afford it, just go online and buy some Ibogaine and take it. Right now, yeah, okay, that might be best case scenario. But I really hope when I get home, I got a home to go to. I live in Miami Beach, and we're about to get hit with the worst hurricane. And my office and apartment are right on the beach. But if that hurricane was not coming, from Palm Beach down to Miami Beach, there are about 30,000 patients in detox or rehab on any given day of the week. How many people are taking Ibogaine on any given day of the week? 20, 30, if I looked at all the clinics, okay? I'd like to see all 30,000 of those patients taking Ibogaine. That one day, when you go to detox, that Ibogaine is the mainstay of detox. Instead of saying, oh, you're on opiates, we're going to bring you into a facility, we're going to treat you like you're in 6th grade, and we're going to give you a little bit less opiate every day until we torture you, and then we'll send you to 90 days of lockdown rehab so you don't relapse because of post-acute withdrawal. Post-acute withdrawal for opiates lasts for 90 days. If you've got 90 days clean and you're not still feeling well, as you mentioned before, there's something else going on there. That's depression or something else, but it's not post-acute withdrawal. PET scans have shown that your brain, your natural endorphins and enkephalins will return, no matter how many years you've used for, will return in 90 days of abstinence. And this holds true for many drugs. It's about 6 months for benzos. It's over 2 years, if never, for methamphetamines. It seems to be the only drug that causes permanent brain damage that may not be curable is methamphetamines. But even alcohol, the brain has its tremendous ability to heal itself up to a point. So what is Ibogaine good for, in my experience? Flood dosing for opiate addiction, yes. The first time I saw it, Dr. Mash came to me in 1996 through a fortuitous meeting, and she said to me, I had already been in recovery myself for 5 years, did it the hard way. I don't think I slept for 6 months, and it was just the most agonizing, painful thing I've ever done in my life. And I was afraid to go to any detox or rehab because the thought of being locked up and having them control my behavior. And so I decided I'm just going to go to Narcotics Anonymous every day and live there, and that worked for me. Deborah said, I've got a drug that stops opiate withdrawal in 1 day, and I said, I've got a bridge to sell you. Yeah, okay, I didn't believe it. I said, I've read your articles, and I just don't believe scientific journals. It's publish or perish, and most of this shit is bullshit, Like the guy who wrote that crystal meth, that ecstasy caused Parkinson's disease, and later on they found out he lied about his information. He was really used to giving the people crystal meth and not ecstasy. And the crystal meth was causing Parkinson's and not MDMA. So she said, bring a patient. And I remember who that first patient was. It was him and his wife. He was a bass player in a very famous rock band, and his wife was a daughter of a very famous country music star. And they had a massive habit because they had a lot of money, like $1,000 a day habit. We gave them Ibogaine, and I saw them wake up the next day and tell me, I feel fine. I said, holy shit. What I just saw was something that was a miracle, literally a miracle. The agony, if I would have taken, I try to explain this to the patients, if you were to get arrested with a habit and I threw you in a jail cell and they left you there for 90 days in a cold turkey withdrawal, 18 hours after your flood dose of Ibogaine, you'll be where you'd be 90 days into that jail cell. And to me, that's something that's really, really important. Maybe the most important discovery in the history of detox medicine. Preventing relapse for alcohol and cocaine abuse, absolutely. Interesting thing, though. If you're going to give Ibogaine for somebody who's an alcoholic, you must alcohol detox them first. Ibogaine will not detox you from alcohol. And alcohol withdrawal is detoxed using benzodiazepines. However, I can take the worst alcoholic and you give them a pretty comfortable detox in 5 to 7 days and give them a flood dose on that 8th day in the absence of abnormal liver findings and cirrhosis and things of that nature. Another thing I found, I started to have the weekend warriors, guys who weren't alcoholic or weren't real cocaine addicts, but they owned nightclubs or they were wealthy. And they said, I go out on the weekends and I drink and I do cocaine and I smoke cigarettes and I wake up the next day and I feel terrible and I hate myself and I swear I'll never do it again. And I go out the next night and I do it again. And then I'm fine for 5 days and I exercise and I run my business. And the next weekend I go out and do it again and I can't stop it. And we started treating these people with Ibogaine with tremendous success after a single dose treatment. finding that it lasted about 6 months to a year, and then some of the behaviors came back. But interestingly enough, every one of these patients after their Ibogaine experience said, that was amazing, I never want to do that again. And then 12 months later, can I do that again? Something happened. They recognize I'm falling back into those old patterns, and before I really get into the swamp, I want to get out of it early. And I've gotten a few phone calls already this week. As soon as you get back, could you please help me? Because I've just fell back into that after 2 years of sobriety. It's a hard thing to do when you own a big nightclub or something, not to drink, when everybody wants to have a drink with you. Crack, crystal meth, etc., plus or minus. In St. Kitts, we treated a lot of crack cocaine addicts and a lot of crystal meth addicts. And we found the success rate in terms of who was really comfortable afterwards and who even stayed clean for 7 days was about 50%. Now, we were in the high 98, 99% for opiate addicts. Rarely did it, maybe 1 in 100 opiate people went home and relapsed the first day. But if you look at standard detox for crystal meth and crack, how successful is it in the U.S. model or the world model? It's not 50%. It's not even 3%. It's probably less than 2%. I mean, those meant, and it's interesting because there's no physical withdrawal from this drug. It's all this psychological craving that's just incredibly intense. So is Ibogaine better than that? Yes. Is it a panacea for that? No, because it's kind of a coin flip if it's going to be of value with you, and it really depends on what your aftercare plan is. I will not take a patient to treatment ever unless they have a firm, sane, rational aftercare plan. And we do this by contractile nature, okay? Whether it's actually written down on a piece of paper or it's done by a handshake, you promise me you're going to do this after treatment or I'm not going to treat you. Because, going to the clinic, going back to your environment, and no one has advised you a single thing what to do when you get home. Most people relapse. So I started to look at what's the success rate of U.S. detox, 90 days of rehab versus single-dose Ibogaine going home with no instructions. And I found, looking at certain clinics and numbers, that the relapse rate post-Ibogaine without aftercare instructions was higher than the U.S. model. Because the people in the U.S. were given 90 days of telling them you've got an incurable disease that could be arrested one day at a time by incorporating certain spiritual principles in your life, and staying clean 24 hours at a time is how you get years under your belt. And this is missing in a lot of the clinics now. People go home and you're cured. Even Nat Geo, if you haven't seen it, Nat Geo Breakthrough, Psychedelic Cure for Addiction, came out in April. Half the show's about Ibogaine, and a lot of that is about an aftercare plan. And I'm talking about serious addicts. The client on that show had a $300 to $600 a day IV heroin habit. He didn't have a vein left in his body. We couldn't draw bloods. We had to put a central line in just to do the treatments, a line in the subclavian vein going to his heart. Ibogaine is the only drug that does not require standard pharmaceutical detox before Ibogaine flood dosing for short-acting opiates. Every other drug, whether it's benzos, something, you need preparation before detox. Caution in long-acting opiates, alcohol, benzos, synthetics, or any centrally acting drugs on board. Any drugs that work on the brain, be it an antidepressant or a blood pressure medication, good idea not to have them on board while you take Ibogaine. We don't know what Ibogaine is doing to the brain. It's a big, giant guess. And until we have PET scans, we don't know. So I don't like to have any other brain drugs on board when I'm doing an Ibogaine treatment. And if you're not familiar with how to detox people off antidepressants, or what's the difference between getting somebody off Lexapro versus Paxil, then defer that patient to somebody who does. Ibogaine carries unique safety risks not seen in other entheogenics. This is a normal EKG with a PQRS complex, and look how beautiful that T wave is. It's a perfect T wave. I first started to notice Ibogaine causes bradycardia, slowing of the heart rate, hypertension, QT-QTC prolongation due to cytochrome P452D6. We've spoken a lot about that in the past. But something that we haven't spoken about in the past, and Torsades, there's a term I coined this term, hyperexcitable heart syndrome. If you've been doing a lot of cocaine, a lot of alcohol, a lot of sympathetic mimetic drugs, stimulant drugs. Even though you might have been off those drugs for a week, you have a hyperexcitable heart. Your heart is more prone to be thrown into a ventricular arrhythmia. And I'm talking about VTAC as opposed to torsades. And if you're not qualified, even if you have a cardiac monitor, to know the difference between VTAC and torsades, you probably should not be doing a treatment. Because the treatment of one, lidocaine, will kill the patient in torsades. And these arrhythmias look very much like each other. And so there are potential ventricular arrhythmias. And if you have other centrally acting drugs on board, like especially SSRIs and NRIs, hyperserotonin syndrome is a possibility, malignant hyperthermia. So I started to notice many years ago from the first Ibogaine patient that as soon as the patient started going into the visual phase of Ibogaine, the T wave on the EKG started to look incredibly bizarre. This beautiful, perfect sine wave. The T wave is basically a pump. It's a tenth of potassium. So when a patient has a low potassium, the T wave goes down. You should always have electrolytes, full bloods on your patients. Always drug test them the day before you treat them. You know when addicts lie? Every time their lips are moving. You know, don't trust your patients. Do the blood test. Labs drawn 3 weeks ago, electrolytes 3 weeks ago, are not good. Don't do cleansing, don't do purges, don't do any of this stuff because you deplete your patients of their electrolytes. I treat patients in the morning, some people start at night, but I keep them fasting for 8 hours. So their last food is at midnight, they can have water, they get dosed 9 o'clock in the morning. To prevent them from throwing up, I give diphenhydramine, a shot of IM Benadryl. 50 milligrams of IM Benadryl seems to prevent 100% of patients from throwing up their dose. What I don't want patients to do is throw up their dose. If they throw up their dose, I don't know how much is left in and what to give now. So it's very important. So for years, I'm wondering what's causing this bizarre T-wave morphology. I've seen T-waves go biphasic, completely disappear. The last patient I just treated, the T-wave went completely flat. It was just a flat line, inconsistent with being alive. Okay? I show it to cardiologists. No one's seen anything else like this ever. Well, over the last few years, something called HERG, the human ether agogo-related gene, I love that word, it's the go-go gene, okay, has been known to cause these bizarre T-wave changes. The sine qua non drug that does this is Haldol, which is the classic antipsychotic to stop a bad LSD trip, which I said never give to a patient under Ibogaine. But Dr. Alper's work, okay, can I do the last few slides? Okay, so I'm going to go through this quickly. These are what some of the bizarre T-waves look like. You see the notching in the T-waves, flattening in the T-waves. I showed this to cardiologists, and they've never seen anything like it. I've never seen any drug, even Haldol, produce the bizarre HERG type of blockade as I see in the T-waves. However, Dr. Alper did a study at NYU, and this study said that Ibogaine is a very potent HERG blocker. However, nor-Ibogaine is as potent a HERG blocker as Ibogaine. This cannot be true. What happens when you give them the flood dose, as soon as the dose starts to hit them, you start to see these T-wave changes. And as the vision stops, 8 to 12, 16 hours later, the T-wave goes back to normal. And when their EKG is exactly back to what it was before I gave them that flood dose, I know I can take off the monitor and pull out the IV. Now, if Dr. Alper's information is correct, those changes wouldn't disappear, and nor Ibogaine, if it is the byproduct of Ibogaine, would probably put patients at severe cardiac risk for the 30 to 90 days that it's on board, and it's not. We've never seen anybody have late arrhythmias after Ibogaine in the absence of some specific reason like electrolyte imbalance. So where should the focus be if we're ever going to get this drug legalized in the United States? It's the only substance on the planet that ameliorates opioid withdrawal symptoms within hours and greatly, if not completely, ameliorates the PAWS, post-acute withdrawal syndrome. This makes it very special and very timely when we are facing an ever-increasing opiate epidemic. How many lives could be saved if safe and affordable medical model of Ibogaine detox were made available in the U.S. and the world? So pre-patient selection, inclusion, exclusion criteria, who is qualified to do a treatment, and this is really important. Standardization of product given. If we're all giving different products, okay? We don't know what the dosage is. I've seen people go online and say, I took 3,200 milligrams of Ibogaine at such and such a clinic. I don't know what they took, but if you took 3,200 milligrams of the Ibogaine that I give people, you'd be dead very, very quickly. Ibogaine is not a wide therapeutic index drug. You can't double the dose and not expect having, serious life-threatening side effects. And what is needed after treatment to ensure success, and what is success? I don't believe Ibogaine is the cure for addiction. I was very mad at National Geographic for using that term psychedelic and using the word cure. I think it's a great way to detox. It's a great way to get through pause. How you treat addiction is something you do on a daily basis, and I'm not sure that repeatedly taking entheogenic drugs every once in a while keeps people clean, because it only takes that quick to relapse. You have 10 years clean, go to the dentist, go home with 12 Vicodins, and you're a heroin addict, and you'll be right back into full-blown mode. And this is an interesting picture that I'm ending with. A Russian patient of mine who's taken Ibogaine, Russian oligarch who was into interesting things, had taken Ibogaine, and aside from never having a drink again, totally changed his paradigm. Became charitable, went into producing natural oil and gas, no more arms dealing. And he had this painting, he made this painting as a gift to me, dedicated to me, and it talks about everything that's going on in this picture. There's a lot going on in this picture, and hopefully when this is up on the internet, people can take a look at it. I think it'd make a great t-shirt one day. But it's a wonderful gift to receive. This artist is supposedly one of the top 3 artists in Russia that lives today. So I think I'm out of time. Thank you for letting me share.